Honourable member for Saskatoon West.
Thank you, Madam Speaker. Madam Speaker, on January 27th, I asked the Honourable Minister of Health about a central principle of the Canada Health Act, equal access for all Canadians to health care. In many places across this country, including my home province of Saskatchewan, wealthy Canadians are getting preferred access to health care services, most notably MRIs. Because the Canada Health Act outlaws user fees and the unequal access to health services is contrary to both the spirit and the letter of the law, I asked the Health Minister when she would act to enforce the Canada Health Act and crack down on private payments. Madam Speaker, the Minister's answer was that she had met with provincial and territorial health ministers and that she's determined to make sure that Canadians will always be able to access the appropriate care they require based on need and not ability to pay. Madam Speaker, while I was encouraged to hear of the Minister's strong commitment to the Canada Health Act, I regret that to date the Minister has yet to announce what she will do to uphold this commitment. I am gravely concerned that Saskatchewan is not only allowing, but actually encouraging the privatization of health care, namely private MRI services. Where is the universality of access if special access to MRIs is given to those who can afford to pay? The Saskatchewan Medical Association, which represents the province's doctors, is opposed to the two-tiered MRI system. The SMA has said that the policy has been implemented hastily and that there is no clear evidence that offering private scans will lead to shorter wait times for the public. Dr. Ryan Miley of the Canadian Doctors for Medicare notes that although Alberta has the second highest number of diagnostic imaging scanners per person in Canada, it also suffers the longest wait times. The real impact of private pay imaging clinics is to give those with money an advantage in obtaining necessary surgery. Private MRIs can cost anywhere from $700 to over $2,000 each. While this cost may be acceptable for some Canadians, it's virtually unaffordable for many, many more. Canada's healthcare system was designed as part of our social safety net to ensure everyone is able to access necessary exams. Canadians are proud of our universal healthcare system, but we must work to strengthen and expand it, not carve off pieces to be sold off to the highest bidder. One of the driving forces behind the creation of our healthcare system is the principle that healthcare should be available to Canadians based on need and not the ability to pay. A for-profit clinic is only beholden to its owners' or shareholders' bottom line and not the well-being of patients. There is an inherent conflict of interest in allowing for-profit operators into a publicly funded healthcare system that seeks to provide medical services for patients regardless of their income level. Just today, we heard about allegations that a private health clinic in Calgary is trying to pressure its doctors into giving preferential treatment to fee-paying patients. Madam Speaker, a two-tiered healthcare system only exacerbates unequal access for Canadians. More than 6,000 people are waiting for an MRI in the province, making it the longest wait list of any special imaging service. Today, there are two for-profit MRI clinics in Regina area, not one in Saskatoon and not one in the north. It's not difficult to see that for-profit providers will locate where it's good for them, not necessarily where patients need the services to be. Indeed, the SMA has said that creating dual access to MRI scans does not reduce surgical wait times. It also suggests it could lead to queue jumping for surgery because those with a completed scan could see a specialist sooner. Madam Speaker, the Minister and this government have to protect public health care across the country by disallowing for-profit clinics and private service providers. When will the Minister act?
The Honourable Parliamentary Secretary to the Minister of Health.
Madam Speaker, thank you for this opportunity to speak today. I'm pleased to take part in this important debate, and I wish to thank the member for raising this issue for our debate at this time. Our government is committed to protecting our publicly funded healthcare system. Like all Canadians, we share the strong belief that all individuals deserve access to timely, quality, universal healthcare, regardless of their background, physical need, where they live, or how much they make. This is one of the core values of our country. Access to health care is an important matter for all Canadians. The Canada Health Act is more than Canada's federal legislation for publicly funded healthcare insurance. It is an integral part of our identity. The Canada Health Act preserves the value embedded in our healthcare system and in our country as a whole, values of equity, accessibility, and solidarity. These are the values that make Canada one of the most desirable countries in the world in which to live. Not only do we have a healthcare system that all Canadians can be proud of, but it forms the bedrock of middle-class economic security. Our publicly funded healthcare system offers a competitive advantage for Canada in an increasingly competitive world. The Canada Health Act requires provincial and territorial health insurance plans to provide medically necessary hospital and physician services to their residents on a prepaid basis and on uniform terms and conditions, permitting payments for faster access to insured health services, including medically necessary MRI services at private diagnostic clinics, which has often been called a queue jumping, contravenes the accessibility criteria of Canada Health Act. Further, when a patient jumps a queue by paying to gain quicker access to a diagnostic service, such as an MRI, they are then able to jump the queue a second time for any follow-up care indicated by the MRI. That is, they gain faster access to both the initial diagnostic test and then they gain quicker access to any required follow-up surgery or procedures in the public system. This is not access based on medical need. This is access based on ability or willingness to pay, and it is in contradiction of the underlying principles of the Canadian healthcare system. It is our belief, Madam Speaker, that the MRI services, when medically necessary, should be covered by provincial plans. I would like to assure the House that the discussions are underway in relationship to this issue. The strong support that our government has for our publicly funded healthcare system is echoed by the support of all Canadians. Polls continue to show that Canadians consider healthcare to be a high priority and that there is a strong support for a principle of access to care based on need. In a September 2015 Equals research poll, when asked if individuals should be allowed to pay extra to get quicker access to healthcare services, 64% of respondents disagreed. Canadians want a system based on need and not their ability to pay. They consider equal and timely access to medically necessary healthcare services to be our national character, not a privilege of status or income. The honourable member may be assured that this government is committed to preserving the fundamental principles of our healthcare system, and we will continue to work with our provinces and territories to ensure access to quality healthcare services based on need and not their ability to pay. Thank you.
The honourable member for Saskatoon West.
Thank you, Madam Speaker, and I'm heartfelt to hear those words around protecting one of the fundamentals of the Canada Health Act, and that is universality. Unfortunately, the government just seems to want to talk about it and not do anything about it. What we were asking her to do is to disallow the service immediately. During this week's emergency debate on the suicide crisis in Attawapiskat, the minister said, and I quote, "It's unacceptable to have multiple tiers of health access. We would agree that all Canadians need to have access to medical care they require based on need and not based on where they live or whether they can pay. It's time for this government to step up and defend the universality and accessibility. It's time to actually enforce the Canada Health Act. Private two-tier healthcare is a very slippery slope that will dismantle our social safety net, and Canadians need to hear their government commit to protecting healthcare for everyone and not just the wealthy." Thank you.
The Honourable Parliamentary Secretary to the Minister of Health.
Thank you, Madam Speaker. I'd like to thank the member for her question. Our government recognizes that universal, publicly funded healthcare is a core Canadian value and a foundation for economic prosperity. This is why our government is committed to upholding the Canada Health Act and its fundamental principle of providing access to medically necessary care based on need and not the ability to pay. We recognize that sustaining a strong universal healthcare system requires the collaboration and cooperation of federal and provincial governments. As such, we are committed to a renewed relationship with our provincial and territorial partners to support their efforts to strengthen our publicly funded universal healthcare system. The federal, provincial, and territorial ministers of health met in January 2016 to discuss common challenges facing our healthcare system. And I'm pleased to note that at the meeting, ministers of health from across the country reaffirmed support for a publicly funded healthcare system and the values on which it is based. Thank you.